like every other thing, and just like every other thing we learned in life, uh, because a lot of people assume that okay, naturally or instinctively they will just go into marriage and they will understand uh, how to have sex when practically everything we have in this world, practically everything we do in this life, we learn them everything, even how to walk, how to talk, how to dress, how to eat, table manners, everything. We practically learn everything. But most times we assume that we just know some things about sex on our own. So it's more or less like something that the whole society, even parents, they shy away from. No parents, except those that are learned and exposed and educated, they are the ones that will say, oh, let me discuss this topic with my children. Most people, they don't discuss it, they shy away. Parents run away. They don't want to talk about all those things. So that's why I would like us to go into the topic. I would like to go into the step by step of everything and the common sexual problems in marriage. There are a lot of problems, but with my research, I've discovered that there are 25 of them. Men have 13, women have 12. So I'm going to talk about them, the causes and the solutions to them, so that we have quality sexual life in marriage. Uh, I, I hope we are hearing me. I hope we are following me. Are you following me? Hello?
Yes, doctor. Yes, we are hearing you.
We are getting
Okay,
you.
so I would like to share my slide. I would like to share my slide. Okay, so that we can all follow me.
Doctor, we can't hear you. You are muted.
Okay, can you see my screen?
We can't
Okay,
hear
can you see?
you,
Yes.
but we can
And,
see your slide. We can see the
okay,
slide, doctor.
okay, and you can hear me now.
We can hear you now.
Okay, and can you see me?
We can see you.
Okay, thank you very much. So let me let me start the topic. My screen is not moving. I don't know. Okay. So, mm. Okay, so can we can see me and hear me, right? Hello?
Yes, we
Hello?
can see you. Go ahead.
Oh, okay. Okay, so I want to thank Father Thaddeus for this opportunity to speak to the great people in this seminar this evening. I really appreciate you, sir. I appreciate your open-mindedness, your spirit-filled leadership, and the impact you are making. I really appreciate it, sir. I want to thank you so much for all your efforts, for everything. So it's on this note I will like to maybe from time to time I'll be checking on us to be sure that we are following me. So you can once in a while I'll be checking on us to know if you are hearing me or if you are following me. So I'll be following the outline we are seeing on the screen. I want to talk about the mind of God for creating sex in marriage. You know, after Adam and Eve got them married, that was when the whole thing said he blessed them and he told them that they should multiply. So the first, I always tell people, I said the first commandment from God to Adam and Eve is to have sex. And they will ask me and say, why? I say, okay, if you are told to multiply, what is the way you multiply naturally? The way you multiply naturally is to have sex. So I always tell people, I say the first commandment of God to human race is have sex because it is from having sex that you multiply. So, and but unfortunately, we have abused it. We have abused it. So I'm going to talk about that. Then the second thing on the outline, I'm going to talk about how to have good sex. Like I said earlier, everything in life, almost everything in life that we came to this world, you know, it was when you are giving birth to as a small baby that you are everything is a reflex, sucking reflex, crying reflex, and all those things. But over time, we learn practically everything: how to wear our clothes, the right way to walk, to how to run, how to eat, how to everything in life. We learn it, and sex is not different. But unfortunately, because a lot of people have this impression that sex is a dirty thing. I don't know where that impression came from. People see it as something that nobody talks about in the society. Everybody eyes up and down to even nobody wants to go near it. Nobody wants to talk about it. Everybody, if you talk about it, everybody looks at you like, what's it? Don't go there. Like it's as if it's a taboo. It's a whereas it's not. It's something coming from God. He said everything created is good. So God gave us sex as a marriage gift, as a something that is a kind of a blessing from God. So, but most people don't learn about it because a lot of people see it as, oh, maybe as in nobody talks about it. So this prevents a lot of people from learning about it. There is a particular good way to have sex. I'm going to teach us. Now, after that, I'll go to the 25 sexual problems in marriage. 25 sexual problems that occur. Men have 13 and women have 12. So I'm going to talk about it. All of us, you are going to see. So now, what is the purpose of sex? Why did God create sex? Number one, God created sex for reproduction. Yes, becoming one through the children. If most of us understand how babies are created, you will see that uh, we are actually one in our children. This is it. Uh, as a man, you have sperms that have 23 chromosomes. as a woman, you have eggs that have 23 chromosomes. And when the two come together through sex, they become one, which is 46 chromosomes. So as you are looking at everybody, you are half of your mother and half of your father. All your qualities, all your personality, everything you are half your mother and half your father. Of course, when you now come to the world, you begin to learn from the environment, you begin to now become your own person. But originally, the product is half father, half mother. Can you see how father and mother become one through their children? So this is the intention of God. For this reason shall a man leave his father, leave his mother, and cleave to his wife, and the two of them shall become one. So people become one through sex, through reproduction. The children, any child that you have, is as a result of you and your wife. That child is a oneness of two of you. Then genetic diversity. If you look at true sex, if you look at any child, that child is not looking exactly like the father and the mother. There is a mixture between the chromosome of the father and the chromosome of the mother. Through the formation of the baby, the thing will mix together, and then we give birth to a different human being entirely, a different human being that has the traits of both the father and the mother. That's second purpose of sex, to create diversity in the genetics of both the father and the mother, to come together and become a special, different human being, of course, which carry all the genetic traits of both the father and the mother. Then bonding. Whenever you have sex and you reach orgasm, there are some hormones that are released in your system. And these hormones, they create bonding. We call them oxytocin, endorphin. There are so many of them. That's why that you have to be careful. You have to run away from premarital sex and extramarital sex. The reason why this can cause problem and confusion for you is because when you have sex with anybody, there are hormones that are released from your brain, and these hormones make you to become bonded with that person. You and that person will become bonded. There is something in you that will start longing for that person. One of those hormones is what we call love hormone. Is oxytocin. It's released in the brain of the man. It's released in the brain of the woman. Immediately you have sex and you reach orgasm. At the peak of that enjoyment, that hormone is released into the system of two of you, which makes two of you to want to have more of each other. This is one of the purpose of God, to make sure that's why sex is very, very sacred. It's something that should be had within the confine of marriage alone. These two shall become one. That is another way that God bond people together through sex. Our body becomes one through sex. So another way is love expression. Sex is a way of expressing your love to your partner. When you love somebody, that's why so many times you use the language like, I want to make love. I want to make love. Yes, making love means that it's a way of expressing how you feel, how much you cherish that person. It's through sex that you can express this. That's another purpose. Then it's an enjoyment from God. When you are not having baby through sex, then it's a way of God saying two of you should enjoy yourself. In fact, sex is rated the highest enjoyment in the world. Highest enjoyment. No food is as sweet and enjoyable as sex. There is a portion of your brain, your limbic system, that by the time you begin to have sex with somebody, there is this attachment, there is this longing, there is this bonding, there is this sensation that you feel towards that person anytime you people meet. So it's a form of enjoyment that God just dash us, we human beings, that okay, through this means, enjoy yourself. And then number 6, sex has healing effects. When you have sex, I know most of us have experienced this. When you have sex with your partner, after that you sleep off. You sleep so soundly. It's a stress reliever. Sex is a sleep enhancer, because immediately you have sex, once you reach orgasm, that is a way that oxytocin, endorphin, sleeping hormone, everything will be released into your system, and then you will relax, and then you will sleep. By the time you wake up, you have sound sleep. That's why I encourage most couples that come to see me to have sex before they sleep, because they will sleep very well soundly. All these are benefits and enjoyments from God. that God dash we human beings through sex. That is why everybody must respect sex as something very sacred and should be had only within the confine of marriage. It's not something to just be, unlike now that we have abused it, we just go up and down, having sex everywhere, even secondary school students, primary school students, university, that, in fact, that is like a even den of fornication. As in, say, that is why there is a lot of heartbreak, a lot of confusion everywhere, a lot of damages, abortion, and so on, because something is something that should be left within the confine of marriage alone. So, how have we abused it? I will mention 4 ways we have abused it. Are we following me? Are we following me?
Yes, we are following.
Yes,
Yes, we are
doctor.
following.
Okay, I want to make sure that we are following it.
35.
Yes. So now, these are the 4 ways that people have abused sex. Number 1, the roots. A lot of people now, even in marriage, it will be shocking for you to know that married people are now engaging.
This is 36.
Okay.
Even married people are now engaging.
So
Hello?
where's 35, please?
Hello? Can I continue?
Yes, you can.
Okay. So there are 4 ways that people have abused sex. The first one is the root through which people are having sex. There are 2 major organs of sexual intimacy. That is the penis for the man and the vagina for the woman. Even anatomically, physiologically, it's obvious. Nature can tell you. But we have started abusing the natural way. We have started using unnatural way, like the mouth. You see a lot of people, you want to now put the penis in the mouth of your wife, or you want to put it in the anus of your wife. This is one of the ways we have abused. God has created a natural root. And with that creation, the anatomy is made that way. If you know the anatomy of the vagina, you know that, yes, it's made for sex. Apart from other things like giving birth to baby, the lining, the anatomy, the histology of the vagina is created for that friction that comes from the penis. But anus is not created for that. If you have sex through the anus, you are going to tear the anus of that woman. You are going to cause cancer because the lining of the anus is not created for such friction. If you continue to have such friction through the anus, that the cells lining the anus will soon transform and become cancerous. The same thing with the throat, the same thing with the mouth. When you have sex through the mouth, there are a lot of things inside our sperm that can cause problem for your throat, and it can lead to throat cancer, to mouth cancer. So when you abuse the nature, you will see the repercussion. So this is one of the ways that people have abused sex. Sex is supposed to be had with penis of the man. That is when I say intercourse now, because sex is very big. There are still other things you can do even before having the intercourse. But the intercourse now, you should have it through the vagina and the penis. Other things, we are the one bringing all these things up and creating problem for ourselves. Then the second one is the quantity. A lot of people, they think sex is something to be had maybe only when you want to give birth. Or a lot of people, when they are growing old, they will say, we have given birth to all our children now. What else are we looking for? No. The purpose of sex is for you to enjoy yourself from the day of your wedding until death do you part. God created it for a lifetime. It's written in the Bible. God said, you people should not even go into fasting without having permission of each other, so that devil does not tempt you. And if you want to fast, it's just for a while, that you should just leave it for a while, and after that, come together, and then continue to enjoy the sex. So you can see, if God Almighty himself is giving this advice, that none of you should abandon sex, you should be enjoying it, only when you want to fast and pray. After you have done that, don't let it even be too long. Go back again, so that devil doesn't tempt you. Because this is why some men, this excuse some men give, and my wife didn't give me sex. So because of that, they started looking outside. Some wives do the same thing. And my husband is not meeting with me. Then they start looking at one man in their place of work. And before you know what is happening, they are breaking the law of God, going to fornication, going to adultery. The the quality of sex is not just to, I have seen a couple, they came to see me. The wife said, the husband will just come from work, he will just grab her, he will just open her leg, he will just enter, he will just do, he say he's tired, and then he will just come off. No, no. The quality of sex is for two of you to enjoy it. The woman takes a longer time to reach orgasm, and that's why I'm going to teach us all those things, so that we can know what to do to make sure that the woman is even the one that we should focus more on when it comes to issue of sex, because it takes a longer time. A man can reach orgasm within 2 minutes. 2 minutes. If a man is looking at a woman naked, he can reach orgasm within 2 minutes. It's already pouring out. But a woman is not like that. So a woman takes average of maybe 10 to 20 minutes, 15 minutes on average to reach orgasm. So I'm going to teach us all those things. So the quality is that you should make sure that, yes, you enjoy sex with your partner, especially the wife should get to the orgasm before the husband will now reach his own orgasm. And we should not weaponize it. Don't weaponize sex. Don't see sex as something you can use to discipline your wife or to discipline your husband. No, don't you. It's not. God is not happy with that. Allow your husband to enjoy himself. Allow your wife to enjoy herself. Two of you should enjoy sex. You can always sit down and communicate and settle your matters. So the last one is the setting. Yes, sex is created to be had within marriage alone. Like I've said, marriage is the only place where sex should take place. The marital sex, extramarital sex, they bring confusion into your life. They bring heartbreak. So people say, oh, I've met a lot of young ladies. They will say, oh, they use condom. They protect it. They are protecting themselves. But can you protect your heart? Can you protect yourself from judgment of God? Because God was clear. Your body is the temple of God. You should not use it to be involved in fornication and adultery. And if you do it, he said he will judge you. Are you using protection against that one too? Are you using protection against when you have heartbreak? Because most times when you have had sex before marriage, you end up in heartbreak. Most of the time, like 80 to 90%, the men will not marry you. Because what they should get inside marriage, you have given them free. So what are they looking for again? They will just dump you and go for another person. The person can even marry somebody he meets today and leave you that has been with him for 10 years having sex with him, because there is nothing new about you anymore. They are seeing you finish, because that's the peak of any woman, and that's the peak of any man. So that's why you should avoid all these abuses. So now, how do you have good sex in marriage? Now, this is the problem. A lot of people think sex can be had just like that. Sex is like a reward in marriage. Yes, between husband and wife, a reward for the husband, a reward for the wife. What am I saying? This is what I meant by that. Everything must be okay. Sex is not only physical. Sex is psychological. Sex is spiritual. Sex is social. Everything must be okay before two of you can have sex. Okay, let me give you a sample. If your wife now, we know we have 4 domains. All human beings have 4 domains. We have our physical domain, which is our body. We have our mental domain, which is our soul. We have our spiritual domain, which is our spirit, who we are. Then we have the social domain, our education, our career, our work, our finance, our friends, our marriage, our parenting, our children, nuclear family, extended family. We live in a community. We live in the world. All these are everything about us. Now, if one of these is not well, you can't enjoy sex. And I will give you an example. If your wife is having severe malaria, is running temperature, is shaking, can you go and sleep with her? Can you go and have sex with her? Now, if your wife is not happy, if your husband is not happy, maybe you people are fighting, can you have sex? Somebody that you are maybe abusing each other, you are insulting each other, you are not happy with each other, you are fighting. How will the sex take place? And then, if two of you are not respecting the laws of God that says, okay, two of you should not use sex as a weapon. You should just give it a little time and then come together. How will you people do it? One of you will start weaponizing it and be using like, because you have talked to me anyhow, you can be keeping grudges and say, because I'm angry, you cannot touch me. Then it will turn to weapon. But if you are spiritual, two of you respect the law of God, you won't use it as a weapon. You will rather settle your fight, because God said your anger should not pass 24 hours. So, but when it passes 24 hours, that's when you sleep on bed and turn your back to each other. So these are all the ways that all these things must be in order. Your body, your soul, your spirit, and even different areas of your life must be in order before you can enjoy sex with each other. Okay, just imagine it now. The work of your wife is stressing her, or the work of your husband is stressing him. He came home so tired, so worn out. How will he even have any sex? Or maybe the community where you are living, there is insecurity. Today they kiss somebody, tomorrow they kiss somebody, and this is bothering two of you. You will even think about sex. You'll be afraid. You'll be thinking of, hey, how are we not going to get killed? So everything must be all right. By the time everything is okay, your marriage is going well, two of you love each other, everything is going on, that's when you can enjoy sex. So sex is like God, it's like a package. That sex is like the soul of a package. Every other thing, the wrap, everything surrounding it must be right before you can now get the reward. It is when your wife is happy, your husband is happy, everything is fine, your work is going on, you are not being stressed, everything is fine. That's when you enjoy sex. That's when you say, oh, come now, let me see you inside the room. Come now, let's do something. Because two of you are happy, the marriage is fine, everybody is good. So that's wow. Then what are the other things that are germane and very important in marriage when you can, for you to have a good sex? Number one is communication. Most times, let's say everything is right, physically, mentally, spiritually, and socially. Do you know that all things can still be right, and then you may not enjoy sex? And that's why I want to mention some other important things that even if everything is right, you still have to look into. Number one is communication. And this is common to women. Most women, they don't initiate sex. They expect their husband to read their mind and know that they want sex. No, you should talk. Open your mouth and tell your husband, can we have sex? Can I see you in the room? I'm feeling horny. It's your husband. There is no shame. No shame. Don't be ashamed of yourselves in marriage. Bible says two of them are naked and they are not ashamed. You can't be ashamed of your husband or of your wife. Open your mouth and talk. Communicate. I am feeling horny. I want to do something. Then go inside and do whatever you want to do. Then emotional intimacy. There is a need for you to be romantic. As husband, I will still talk about this in what I call in the foreplay. You have to be emotionally intimate with your husband and with your wife. Two of you must be emotionally in love with each other, be romantic with each other, love each other before sex can really come. Then prioritize sex. That it's very easy to get lost in all this hurry. You are going to work, you are going to this, I'm busy, I'm doing this one. Before you know what's happening, 1 week, 2 weeks, 3 weeks, you people are not having any sex because you have gotten lost. You want to parent the child, a lot of things are calling your attention. A lot of things are taking your attention. So you want to parent your child, you want to do this one, you want to look for money, you want to look for something, you want to do this in the church, you want to do this one. Before you know what is happening, two of you have forgotten each other. So you have to be intentional about having sex. At least you should not miss a week without having sex. Except maybe your wife is menstruating or is pregnant or she just delivered. There are so many conditions that can make you to say, oh, let me allow my wife to recover, or let me allow my husband, or you travel. All those things can be there. But if all these things are not there, at least in a week, you should have sex at least 1 or twice in a week. Then apart from that, there are some sexual realities of life we must adjust to according to age. The truth of the matter is that a couple that got married and husband is 40 years, the wife is maybe 35 or 30, the way you will have sex, the energy, it cannot be the same as when you are now 80 and 90. As you grow old, our strength goes down. So I'm not expecting now that somebody is husband and wife that are 90, 80 respectively should be having sex 3 times in a week. Unlike young couple, 40, 30. I can say, oh, you guys, even more than 3 times, enjoy yourself. You have the energy, you have the everything. So we should adjust to that one too, so that we don't feel like, oh, we are not having enough sex. Age is a factor. Then be innovative about your sexual life. There are 72 different styles. You will still go through the vagina, you will still use the penis, but there are different ways. You don't have to do a missionary style all the time. And you don't have to use the bedroom all the time, especially if your house is not crowded. If you people have enough, maybe your children is boarding school, it's only you and your husband. Sometimes in the sitting room, you can have sex. Sometimes in the bathroom, you can have sex. In the kitchen, as far as you are not cooking, that you can get injured. Anywhere you like in your house, you can have sex. It's not only that bedroom and that bed and one position all the time. Be open-minded about sex. and then use different styles. It's not all the time that is missionary. The husband must lie on the wife, and that is the end. Sometimes the woman too can be on top, the man can be on top, they can lie side by side, you can stand up and have it, your husband can sit down, the wife can sit on the penis. There are so many postures. So don't be boring, don't become monotonous, that every time it's just the wife lying down, the husband lying on top, and that is the end. For 1 year, 20 years of marriage, 30 years of marriage, 50 years anniversary, and that's the only way. No. You have to do better on that. Then avoid extramarital sex. It destroys marriage. It destroys marital sex. Premarital sex and extramarital sex destroy marital sex. So these are the 3 types of sex: premarital sex, extramarital sex, and marital sex. Marital sex is the only one approved by God. Extramarital sex will destroy your marital sex. By the time you go out, you meet one side chick, you have had sex outside, you come home tired, you can't even do anything with your own wife, or it's the other way around too. Then practice other sexual intimacy acts. It's not only penetrative sex that is everything about sexual intimacy. No. There are so many other things you can do. Kiss your wife often. Wife, kiss your husband often. You people should cuddle each other. Lie down on bed and cuddle each other. Spank the bum of your wife. Spank the bum of your husband. You people should be playful. Play with your different body parts. Two of you are one. Do whatever you like with your body as far as it's not injurious to any of you and it's not breaking the law of God. You know, be open and free when it comes to sexual intimacy. Then, what are the 4 phases of sex? The first one is desire phase. This is when you are horny. As a man, you start thinking about sex like, I want to have sex. That's desire phase. Then as a wife, the same thing, you can desire sex. Then you go to arousal phase. Arousal phase is when you are already aroused. You people have played with each other, you have touched each other, you have kissed, you have done everything. Then the sexual organs are ready. The penis is standing, is hard, is erect, while the wife is wet. You know, a woman has a kind of where it can be penetrated, while a man has what it can use to penetrate. So the 2 organs are ready. This one is standing and erect to enter the place, and the place is wet enough to allow it to enter. So that is arousal. Then orgasm is when you now do the heart and you get to the peak. You know, sex is like building pressure. It's like building, it's like you are going somewhere. It's like you are going to the ceiling. From the ground floor, you are going. Then at the time you get to the roof, that roof is the climax. That is the orgasm. That is when the man will pour everything away, and then the man will pour everything, and the woman too. You see the woman holding the husband tight, and then, no, I'm enjoying it. When you get to that peak, that is the peak. That is where every sex you get to for you to enjoy it. Then the resolution phase. After the woman has gotten to that level, and the man has gotten to that level, then your body will now start coming down from that roof. It will start coming down, but it gets to the ground floor. These are the 4 phases of sex. Now, how do you have sex? How do you have good sex? Number 1, there are 3 things you need to know about having good sex. The first one is foreplay. There are so many things you need to do. Foreplay simply means the things you do before you go into the penetrative sex itself. The things you do. And this involves all the things I've mentioned in the past. Being good, this thing with each other, being good time with each other, no marital conflict, you are taking care of your wife. A woman that has not eaten, you are saying she come and have sex. You should feed your wife, take care of your family, take care of your wife, and then be romantic. As in, you know, your wife is at work, you can send a message, how are you doing? I love you, I can't wait to have you. And then your wife sends such message, I'm thinking about you. You buy a little gift, ice cream on the way when you are coming, yogurt. As in, some things that you can use to, like a gift, you give to each other. Bible says the gift of a man makes way for him. By the time you get home, and you want to have your way, if you have made way for yourself through gifts, through romantic texts and all those things, it will be so easy. So these are all part of foreplay. You see your wife she's cooking in the kitchen, spank her bum and say, wow, I love you, you are blessed. All these things, touch your wife the way you like. All these things stimulate arousal, it stimulates desire. You know, your wife will even know from all those play that is like this man is in the mood, he wants to do something. And the other way around too. Your wife is touching you, is playing with you. You should have an idea that it's like this woman is in the mood to do something. All these are what we call foreplay, you know. And part of the foreplay again are the things you now do on bed when you are now in bed, you know. So those are the two phases of foreplay. The things you do, the foreplay you do outside the bed, which is playing with your wife, playing with your husband, exchanging romantic text messages, and all those things. Then the one you do on bed, these are still part of foreplay. Fore means before. You have not gone into the play itself. So what are part of the things you can do when you now get to bed? When you get to bed, the husband is there, the wife is there. You can take your bath so that you are fresh. Then when you get to use your perfume, wear your nightie, revealing nightie, things that are seductive to your husband, wear them. Don't go and wear wrapper on your chest in the night and say you want to go and sleep on bed with your wife, with your husband. Loosen up, be naked. Wear something revealing that your husband will be staring as if he's not the owner of the thing. So all those things are very important. They are all part of foreplay. Then when you now get to bed and you want to have the play, what are the things you can do before you have the play? So that the woman, because a woman's body is specially designed by God. We men, we are stimulated by sight. What we see, immediately we see the breast of our wife, we see the vagina, we see the bum, we are already stimulated. As a man, everything's already standing. But women are not like that. You still need to touch them. You need to speak good things to them. You need to tell them how sexy, how romantic. You mention all different parts of their body. I love your breast. I love your nipple. I love your bum. I love this one. Oh, you are so lovely. You are so beautiful. I love your hair. You know, by the time you see all these things, women are stimulated by what they hear and touch. What they hear and how you touch them. Why men, we just have to see. Once we see like this, everywhere don't open up. So all these are part of foreplay. These are part of the things we should know. Now, what are the places or the erogenous area, sexy area in the body of your wife and in the body of your husband you should know? Number one, the hair of a woman is very sensitive. The lips, that's why we kiss. The ears, the back of the neck, the breast, the nipple, the vagina, internal laps, the inner side of the laps, the bum, all these places are very, very sensitive to touch. So, but the most sensitive part of a woman's body sexually is the clitoris. It has more than 8,000 nerve endings, very, very sensitive. That is why it's not good to circumcise a female child. It's not good. You will be depriving that child of enjoying sex in a marriage in the future. You know, that's the most sensitive place in a woman's body when it comes to sex. If you can caress the clitoris of your wife very well, and there is a place inside the vagina, we call it G-spot. When you enter into the vagina, in the upper part of the vagina, like 5 centimeters inside, that place too is very sensitive, but it is second to clitoris. Clitoris is just above the vagina. You will see there, that organ is the sexual organ of a woman. So when you are touching it through the foreplay, the woman will be so wet. Even touching it alone can make the woman to go into orgasm. If you know how to use your hand, your finger very well, and your finger must be very clean. You must learn to cut your nails and wash your hand clean. That's why I say you should take your bath before having sexual intimacy with your wife or with your husband, so that as you are touching, as you are using your finger, you are not putting infection or introducing anything to your wife, because a woman is very sensitive to all those things. So this is very important in foreplay. So take time, average of like 10 to 20 minutes. Don't rush. Most men rush when it comes to sex. Once they get to bed, the first thing you want to do is to open the leg of the wife and enter. No, that's the play. Leave it. Do foreplay. Touch your wife very well. Touch the hair, kiss the mouth, suck the breast, touch it. Touch the clitoris. Do all those things. Then you do the same thing to your husband. The sensitive part of a man's body the neck, the lips, the hairs. The nipple of a man is also sensitive. The penis, the head of the penis is the most sensitive part of a man's, in fact, that's the sexual organ of a man. The cap of the penis is very sensitive. So when you touch it and caress it very well, wow, the man will be in the third heaven. So touch all those things. When you people are now well stimulated, aha, you are now ready for the play. So that is the foreplay. So what is the play now? The play is the intercourse inside. Everything I've talked about now is extercourse, outside, external. Now you want to have the intercourse, which is going inside. That is the play. So the play now, how do you do it? A lot of men make mistake here. They will just rush in and they will begin to do. And then within 2-3 minutes, they will reach orgasm and they will ejaculate, they will release. And then the wife is left stranded. A woman needs an average of 15 minutes in a penetrative sex. You have to continue doing. As you are doing, you must multitask. You must be touching the clitoris at the same time. You must be kissing her. You must be sucking the nipple. You must be doing all those things and be doing the penetrative sex. That's why you should not rush. Immediately you people have done the foreplay and the woman is now ready. The body is prepared. It's wet. Everything is fine. Everything is standing. Yes, you can go inside. When you go inside, there's something we call stop and start technique. Enter slowly and come out slowly. Just be doing it gently, be going gently. Don't rush. Don't do no. Don't rush. Take your time. Be entering as you are doing it. Be using your mouth to speak. Be saying good things to the woman. How you are so sexy. You are so sweet. You are the best in the world. Be saying all those things stimulate a woman. You have to multi-stimulate a woman to make a woman reach orgasm. As you are using your mouth to suck the breast, you are using your mouth to tell her, oh, you are so beautiful, you are so sexy, wow, I'm enjoying you, you are so lovely, you are so lovely. Be saying all those things. And as you are touching everything, be touching the clitoris while the penis is doing the job under. Don't rush, be entering slowly and be coming out slowly. And when you see that it's like the thing is coming, you're about to reach orgasm, and your wife has not reached orgasm, see how you can delay your own orgasm. And there are so many things you can do to do that. Number one, you can use your tongue to scratch the roof of your mouth. If you do that, it's very distracting. So it will make you as a man to lose distraction on you reaching orgasm, and that will lessen the orgasm. That's one. Two, another thing you can do is, if you know that the urge is really strong and you're about to pour, you're about to ejaculate, because that will be the end of your own, and your wife is still left stranded. What you do is you can pull out small and be doing other things. You can be sucking the breast, you can be playing with her. When you see that the urge has calmed down, you can go inside back and continue. Apart from that, you can pull out again and touch the head of your penis as if you are pressing it. It will make the urge to die down. And then another thing you can do, you can use your left hand to pull back your scrotum. Use your left hand to go back and pull up your scrotum. It will not allow you to ejaculate. So by the time you deploy all these methods and techniques, you'll be able to last for at least an average of 20 minutes. A woman doesn't need more than that. If you have done a good job in the foreplay and you do all this during the play, your wife will reach orgasm. And by the time you reach orgasm, she will hold you so tight. She will hold you, she will shout, she will mourn. She will tell you, I'm coming. Oh, as in, by the time you have done that, you have succeeded as a man. That is why in having a good sex in marriage, a man must be selfless. You must prioritize your wife, who needs a longer time to reach ejaculation, to reach orgasm. So you postpone your own enjoyment first. You don't need more than 2 minutes as a man to come. You don't need more than that. So that's why you should do everything to delay your own and satisfy your wife first. When your wife has now reached orgasm and he told you that, yes, I'm okay now. Hey, you speed up, leave all those techniques. Within 2 minutes, you will pour everything and you are okay, and everybody is fine. So these are all the things. These are all the things that you need to pay attention to. You need to take note. Now, when you have done this, the hind play, that is after you have now had the sex and everything is good. Some people, some men, some women, they will just stand up and they will say, they are okay. They are okay. they are good now, they want to go and see their friend, they will even take time to really do the necessary thing. You are not supposed to stand up immediately and say you want to go and see somebody when you and your wife just finish having sexual intimacy. No. There are 3 things you need to do immediately you have finished having sex with your wife or with your husband. You people should hold each other, should cuddle each other. Yes, cuddle each other. Because the other person will feel used. I just finished, I just quickly wear my trousers, I say, I want to see somebody. No. You wait, you cuddle the person, you let the person's body calm down. When the person's body has now calmed down, hey, good. Then you now do this following thing. Appreciate, affirm all the things you enjoy, all the things you love in what you have done. Oh, I love the way you touch me in this place. I love the way you suck my breast. I love, tell each other so that the person can do more of that in the next episode, in the next session. Tell each other, appreciate what you enjoy. Then criticize lovingly. I repeat, underline, lovingly what you don't like. Maybe your wife or your husband has touched you in a particular way during that session and you don't really enjoy it. You can say it that, you touched me in this particular way that time. I think I would prefer you touch this place other than this place. So that she will know, so that he will know. Next time he will not do it or she will not do it. So that she can do more of the ones you have appreciated, so that you can enjoy more. The quality of your sex life will improve. Then the last thing is that 2 of you should urinate. Immediately you have done that, go to the toilet, go and urinate, drink water. Because sex is a big exercise. By the time you have done that for 20 minutes, you have sweated, you have done a lot of things. So your energy is depleted, go and drink water, then urinate, and then 2 of you can go to bed. So that's how to have good sex in marriage. So I will see if you need more knowledge on that, then I will talk about it. Now, to the sexual problems, are we following me? Are we following me?
Yes, doctor.
Okay. Now, what are the sexual problems in marriage? They are similar. They are similar in man, they are similar in woman. But the men's zone is 13, the woman's zone is 12. Now, what are these? All these problems can come up from any of those 4 phases, 4 stages that I've talked about. It may be desire. Desire is libido. The problem may come from arousal. The problem may come from reaching orgasm, and the problem may come from resolution stage. So the 13 from men is low sexual desire. The man is not just in the mood, he's not happy, he's not interested in having any sex. Sex avoidance. The man may just be avoiding sex with the wife. I will tell us the causes and the solution to it. Arousal problem. It may be an erection problem. That's the 3rd problem. This is one of the commonest problems I've seen in my consulting room. Men coming to me and say, the headquarter is not working, the John Thomas is not standing, and you see the wife following him, we don't join with that one. This week alone, I've seen 2-3 couples in my consulting room. The wife is the one that even led the way. Doctor, it's not working, it's not working. I say, madam, calm down. By God's grace, we will resolve the problem. Don't worry. I said, doctor, please help us. As me, I was just, so that's to tell you that it's a serious problem in marriage. We call it erectile dysfunction. Then lack of sexual excitement. The man is not just excited when it comes to sex. Then orgasm problem. It can be premature ejaculation. This one is also very common. That's why you see a lot of men being called 2 minutes man. They say, I say 2 minutes man. Pew, he has fought. Pew. In fact, I know one man, they came to see me, merely looking at the wife like this. You just see the breast of his wife. His own wife, everywhere is wet. The pants, everything has released already. They can't even have the sex. The penis will now come down and be looking down. The wife will now say, okay, if you see my nakedness and you have poured everything, so what will I now enjoy? Then there is problem. So all of this, I have to train the man how to reduce his sensitivity. I have to do a lot of job before they were now okay. Then delayed ejaculation. This one is very surprising. The one we see most times, 90% of time is premature ejaculation. Ping, 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 the man has come. But this one, there are some people that have delayed ejaculation. Their inability to reach orgasm, this one too is very strange. The person will do, I have met a lot of women, they tell me that a lot of men, they say they have never reached orgasm in their life. They are just hearing about it. That there is a point you get to in sex, and the thing will grab your body, and you enjoy it. And they enjoy it, but they have not gotten to that maximum level. So that's another problem. Then pain during sex is very common. People will say, as I'm having sex with my wife, I'm feeling pain. Pain during ejaculation too is very common. They are not having pain when they're having the sex, so but when it gets to the point of ejaculating, they will start feeling pain. Then curvature of the penis. Some people are born with penis that are curved, and anytime they want to have sex, that curvature, that curved penis will give them pain. Then you have pain in the prostate. Prostate is inside the man, close to the neck of the penis. Some people, when they're having sex, that's where they are feeling pain, deep inside their pelvis, deep inside their waist. They say, doctor, it's not my penis, but inside, when I'm having sex, I'll be feeling pain. That one is another problem. Then the 11th one, this one is very common too. Performance anxiety. Many men have performance anxiety. Performance anxiety is you are afraid that you may not deliver. Some people see sex as a task. They see it as they want to do something. They want to do a project. So they are afraid that, I hope I will be able to make my wife to reach orgasm. They will be scared. They will be afraid. That's performance anxiety. And most times, people that have that fear, they don't. Fear is like a snare. They won't be able to do it. They are scared that they will not do it, and they will not do it. So, their lack of interest in sex due to psychological causes. Sex is very psychological. Sex starts from the mind before even the body. So, there are a lot of psychological causes that can make a man or a woman not to be interested in sex. So, it's common in men. Then we have an hormone. We call it sex hormone. A man has sex hormone, a woman has sex hormone. The sex hormone of a man is called testosterone, while the one of a woman is called estrogen. If that hormone, the hormone is like the thing that God created in your body to make all your sexual organs to stand and to be prepared for sex. If they are low, they can cause you not to have good sex. So these are the 13 problems in a man. In a woman, the same thing. A woman too can have low sexual libido. It can be avoiding sex with the husband. I will tell us the reason why this can happen. These are the problems you see in marriage every day. A lot of women will come to my room, and in my consulting room, they will be telling me that, I beg, forget about that man. He's sleeping around. Different women, I cannot allow him to touch me. They are now avoiding sex with their husband. These are all the problems, and I will tell us the cause and the solution. Difficulty becoming physically aroused despite desire. Some housewives, they want to have sex, but they are not happy with their husband. Something is stopping them. If their husband touch them till tomorrow, they'll just be there like a log of wood. Because the man is doing some things emotionally to them that is making them not to be happy. And that makes their body not to respond to all the things that the man is doing. Kiss them, touch them, suck their breasts. They'll just be looking at the man like this. When you are done, let me know so that I can sleep. I will tell us the reason and the solution to this. Then, vaginal dryness during sex. A lot of women, they will get stimulated, they will be wet. Then the husband will want to penetrate. As the husband penetrates, within 2-3 minutes, they are dry. It will not be paining them. As the man is doing, it's paining them. They will have to use cream or use oil and all those things. I will tell us the reason for that. The same thing with orgasm. Many women have told me this, that they have never reached orgasm before in their life. Some women, they have reached orgasm before, but it's difficult. They shall try before they get there. Then, some women have pain during sex. Some women, when their husband wants to touch them, they are afraid. They are running away because of that pain. And then some people, they have what we call vaginismus. Vaginismus is when your vagina is closing. Anytime your husband wants to penetrate you, your vagina will quickly close. Yes, I will tell us the reason and why it happens in marriage. Then, some women, they have pain around their vagina. And they have pain. So, anytime the husband wants to come near them, because they remember that last time they didn't enjoy it and it was painful, they run away. What can cause this kind of pain? I will tell us, and the reason and the solution. Then, sexual dissatisfaction. If you gather 100 women, 80% of them are not satisfied sexually. because the men don't know what to do and how to do it. So they are doing sex like a service in marriage. Doctor, what will I do now? It's my husband. If you don't do it, it can make him to go outside, but I'm not enjoying it. Sexual dissatisfaction, very common in women in marriage. Their body image, a lot of women, their body image issue. Some women, they want to be slim, but they are fat. Because they are fat, it makes them to think they are not good enough. There's some women, before they give birth, before they have their children, they are leopard, they are slim, they are fine to them. But after they are giving birth to 3, 4, 5, they believe that they are no longer looking beautiful. They are not sexy. So the husband doesn't find them attractive again. And that psychologically affects them and affects their sexual life. And another thing is sex hormone. Like I said, the sex hormone of a woman is estrogen. Estrogen, if a woman doesn't have enough of that hormone, he will not have libido, he will not be interested in sex, he will not enjoy sex. So these are the 12 problems of sexual dysfunction in women. Now, let's look at this one by one. Are we following me? Are we following me?
Yes. Yes, doctor.
Can somebody affirm that they are following me?
Yes, we are following.
Doctor, go on.
Yes,
Okay,
doctor, we are following you.
So what are the 13 sexual problems that a man can have in marriage with sex? The first one is low libido, low desire. The man is back from work and you said that my husband, you are playing with the husband or you are playing with the wife. He said, I beg, leave me. You don't know more than sex. The man is not interested. What can make a man to have this kind of low desire for sex in marriage? Number one is the sex hormone called testosterone can be low inside that man. The man can have some body illnesses, maybe hypertension, diabetes, a lot of sicknesses can make a man that is not feeling fine, cannot even think about sex. Then there are some drugs that if you are taking them, they can make you to have low libido. There are some antihypertensive drugs, hypertension drugs like moderatic, those ones that make you to urinate, or antidepressants, all these drugs that you use for psychological problems, they can lower libido of a man. Then if you are abusing substance, you are smoking, you are drinking alcohol, your libido will naturally go down because smoking and alcohol, they reduce your testosterone. Testosterone is what gives you fire in your system as a man that want to make you to have sex. But when you drink alcohol and you smoke, it will reduce it. Then stress. If a man is stressed, forget about sex. So he's not interested, he just wants to rest. Then a man that does not exercise is likely to be fat, is likely to be weak. So any man that does exercise, that is fit, will likely have a higher testosterone and will be able to enjoy sex and have desire for sex more than somebody who doesn't have exercise. Then low balanced diet. A lot of men is fufu, gari. You must eat balanced diet before your libido can be good. Depression. Oh, any man that is depressed is not happy, is not interested, is down, is thinking. He can, in fact, depending cannot even stand. Then mental stress, you are mentally stressed. Then marital conflict. Please let me beg us women at this one. Please don't be insulting your husband. Don't be fighting your husband. Men are designed to be respected. Men are designed to be, as the head of the family. As the head of the family, God made them the head. And God says submit unto your husband. Submission means respect. And when you don't respect a man, forget about sex. Forget about sex. This thing will not stand because God naturally made a man that way. A man wants to feel respected. And once you withdraw that respect, also goes with that respect is the urge, the libido. Then past trauma, a man that has been raped before, he's not interested in sex. So these are all the things that can cause low sexual libido. And their solution is according to the problem. If your testosterone is low, go to hospital, they will check it and give you drug that will raise it. If you are sick, go and treat yourself. Any drug that you are using, either you are using a hypertension drug that is not making you to have libido, we can change it to another one that will not affect your libido. If you are drinking alcohol, stop. If you are smoking, if you are stressed, find a way to relax. Exercise, eat balanced diet, protein, fat, everything, let it be in your food. If you are depressed, go and see your doctor. Conflict. You have to be or be at peace with your wife. And wife, find a way of respecting your husband. Then any past trauma, psychologist, let them treat you. Then the second problem, sex avoidance in men. Men avoid sex. The reasons are the following: because they have anxiety problem, they are depressed, they are afraid they may not be able to, they may have past trauma, they have low self-esteem. And then this sexual orientation, somebody will say, I think I'm a woman. A woman will think is all those things can make you to avoid sex. Then marital conflict. Then monotony in sex. Every time, missionary style. You already know the way it will go. There is not anxiety about it. So that can make you not to be interested. And if there is loss of love, you people don't love each other again. There is emotional disconnect. Then testosterone is low, or you are sick. Like I've said, side effects of drugs. Then if you don't sleep very well, your urge to have sex will be low. Then negative spiritual upbringing. This one now, let me warn us parents. Don't educate your child wrongly about sex. Most of us do this. We tell our children that if a man just touch you, you get pregnant. Oh. If a man just talk to you, you get pregnant. Oh. If you have premarital sex, if our sex is very terrible, that's not how to educate a child about sex. Tell the child the truth about sex. Let the child know that this is your organ, this is your vagina, this is your penis. Sex is this way, They don't have it. Don't have premarital sex. Tell the child about the complications of premarital sex. You can get pregnant. You can drop out of school. You can become a mother so early. It takes a lot to be a mother. Your school will stop. Tell them the consequences. By the time they hear the consequences, they are the ones that will run away themselves. Tell them that only in marriage is sex okay. Give them the right information. Don't deceive them. Don't scare them. Don't put fear in them. Because some of them, they don't get to overcome that thing. By the time they now get married, it will still be affecting them. They will still be thinking that sex is a terrible thing. That sex is a bad thing. So those are the things that you should give them the right sex education. Then erection problem. Why is a man having erection problem? Chronic illness like diabetes, hypertension, they can make a man's erection not to be good. Anxiety, depression, marital conflicts, you and your wife are fighting. Stress, side effect of drugs, sleep problem, you are not sleeping well, you will not have erection. Smoking, alcohol, substance abuse, you are alcoholos, you are taking all this cocaine, then poor diets. These are all the things that can cause erection problems. And the solution is according to what I've said earlier. All this can be resolved. If you are sick, go and see your doctor. If you are depressed, go and see your doctor. If you and your wife are fighting, you can see a marriage counselor. Stress, as much as possible, avoid it. Change the drug that is giving you low libido or erection problem. Sleep very well, 8 hours in a day. Stop smoking, stop alcohol, stop abusing substance. Then number 4, lack of sexual excitement. All the things I've mentioned can cause it: anxiety, depression, marital conflict, low testosterone, low exercise, illnesses, side effects of drug, sleep problem, erection problem, dysfunction, overweight. It's not good for a man to be too big. When you are too fat as a man, you won't have good sexual life. Even the weight alone will not even, there's a way that it dampens your testosterone. There's a way that when you are too fat, you are lazy in bed. Do something, shed the weight, and you'll be good. Stress, lack of balanced diet. Then this one again, uninduced desensitization. A lot of men, they watch a lot of porn. and they masturbate privately. And by the time they are done with this, their wife will be nobody to them because they are already satisfied. Avoid pornography. Avoid masturbation so that your heart will be full, so that you can have more desire for your wife. Very, very important. Premature ejaculation, that's number 5. Why is it that some men are 2 minutes men? Immediately you see your wife like this, immediately you enter your wife like this, you do small, that pod. Your wife is now looking at you like, okay, oh God, now that you have reached your own orgasm, you have come. What about me? You now be looking. What are the things that can cause all these things? Performance anxiety. Stop being afraid. Stop being afraid that you have confidence in yourself that you can make love to your wife and you will make your wife to reach orgasm. Have that confidence. Stop being fearful. Then go and see doctor if you have anxiety problem. Stress problem. If you are stressed, reduce your stress. These are the things that make a man to come within 2 minutes. Depression. If your testosterone is low, if your thyroid hormone is low, erectile dysfunction, if you have infection, sexually transmitted disease, gonorrhea, all sorts of sexually transmitted disease, they can make you to come easily on time. Then urinary tract infection, it can make you to come on time. Then negative spiritual upbringing, like I've said, parents telling their children the wrong thing about sex. So it should not even make them to have urge when they are now married that they should be having the sex because their parents have told them that sex. So all this can reduce your premature ejaculation. Then delayed ejaculation, almost the same thing I've mentioned, can also cause delayed ejaculation. But here, I will put our attention to penis or prostate nerve injury. If you have spinal cord injury, or if you have low back injury, if you have low back pain, it can make you not to be able to reach ejaculation on time. So if you know that at your back, in your low back, you are feeling pain, come and see your doctor. Let them see what the problem is. Number 7, inability to reach orgasm. Almost everything I've mentioned can also cause that one. You can see it on the screen. One of them I will mention is stroke. Somebody that has had stroke before, the person can find it difficult to reach orgasm. The person will just be having sex, but will not be able to reach orgasm. Stroke has a way of causing that. There are other things. If you are too big, if you are watching pornography, all these things can make you not to reach orgasm easily. Excessive alcohol, smoking, all these things, they can delay orgasm in you. Then pain during sex. What can cause pain during ejaculation? You have had sex with your wife at the point of reaching orgasm that you should ejaculate. You started feeling pain. The things that can cause it is if you have BPH, if your prostate is big, if your prostate is inflamed, infected, if you have infection of your testes, if you have infection of your seminal cord, if you have infection in your inside your penis where you urinate from, urethritis, if you have sexually transmitted disease, if you have just had surgery inside your penis or in your prostate, anxiety, sexual abuse, past trauma, you have been raped before as a man, all this can give you pain during ejaculation. And the solution is according to the problems, the sources. Then painful curvature. Some people are born with their penis curved. If you have this kind of curved penis, you look at the shape of your penis, it's curved like this. It's not a normal thing. Come and see a doctor. We can rectify it. We can straighten it. The penis should be straight, not curved. So this is very important. Then there are some things that can also come when you're having sex. If you are not careful, you can break your penis, and this can give you problem. It can make your penis to curve after healing. Then number 10, if you have pain in your prostate during sex, this one can be due to infection. It can be due to big prostate, what we call BPH, sexually transmitted disease. And there's something called prostate stone. Just the way we have kidney stone, we have tonsil stone, we also have prostate stone. Stone can be inside your prostate, and this will give you pain during sex in your prostate. Then if you have just done surgery on your prostate, it can give you pain during sex. What are the other problems a man can have sexually? Performance anxiety, fear of performing. Some people, they believe that, fear performance failure. They believe that, I cannot make my wife to reach 20 minutes to reach orgasm. Stop being afraid. Low self-esteem. You don't believe in yourself as a man. It can affect your performance in bed. Anxiety. So many men are anxious. Immediately say, oh, my wife say, come now, my husband, let's go have sex. You see the man sweating. He's afraid that I won't be able to make love enough for the wife, to make the wife to get to where she gets to. Depression. Then you partner. Some people, for example, maybe somebody is a widow who is just getting married and you want to start having sex with a new person. You can be anxious. This person may be different anatomically down there. So the pathway you are used to before, the person is no more. Now you have a new partner who is different. Maybe it's tighter, maybe it's, different things can make you to quickly, you are now afraid. You don't need to be afraid. This new partner has come. Take your time, learn with the new partner, and then you come up, and over time, you guys will know each other very well, and then you are at home. You can rest. Then marital conflicts, it can bring performance anxiety. Yes. Then pressure due to personal or societal expectation. I don't know, some people will go and watch pornography. This is a film that people have cut. Maybe that man you see in that pornography that can spend 2 hours. You don't know, maybe he's doing five minutes and they are joining the film. But you went to go and watch it. You think a man can last for 2 hours without stopping. Then when you not get to bed, you can't do it. You are afraid that you may not be able to last for 2 hours. It's fake, oh. There is no man that can last for 2 hours at a stretch. So all those expectations, right? Do the right thing. You and your wife should come to a kind of compromise. Enjoy yourself. Diabetes, physical stress, sleep problem, alcohol. All those things can cause performance anxiety. Number 2, lack of interest in sex due to psychological causes. Now, this can come from stress, anxiety, depression, past trauma, sexual abuse, marital conflict. If you have body image problem, you think you are not. Some people, they believe that a man must have 6-pack. And that's how a man should look. Who told you? Who said that society? Whatever how you look, as far as you are looking healthy, if you are too fat, yes, work on yourself and reduce your weight. But you don't have to have 6-pack. Of course, if you have 6-pack, no problem. But don't begin to hate your body because one person has 6-pack and you don't have 6-pack. You are good as the way God created you. You can be better. Low self-esteem, all those things, you should avoid it. You should work on it. You should see your doctor. Then the last one on a man, sex hormone. It comes with age. Your testosterone can go down. God created us that way. As you are growing older, your sex hormone goes down. But there is solution. You can see your doctor. They can give you injection, they can give you drug, and it will go up. And then your sexual urge will come back. Then if you are sick, go and see your doctor. Sickness can make your sex hormone to go down. If you are not eating well, if you are not exercising, if you take alcohol, there are some drugs that can make your sex hormone to go down and your urge will go down too. Infection, depression, mental fatigue. If you are always stressed, you walk, you don't rest. It can make your sex hormone to go down and then your urge will disappear. So these are all the problems of a man that sex can be affected. So before I go to the woman's zone, are we following me? Are we following me?
Yes, doctor, but some are not muting their
we
we
are.
are hearing some background.
Yes, we are, doctor.
Okay, so this is the last part of the thing, so that I will now allow us to ask our questions. Now, women have 12 sexual problems in marriage. The first one too is low libido. When you come home to your wife and say, you touch your wife and say, can we go inside? You say, I beg, leave me alone. I'm not interested. I'm not in the mood. Most times, what causes this? Pregnancy can cause it. Pregnancy is a very special state for a woman. Some of them, they want to have sex. Some of them, they don't even want you to come near them. Please show understanding in this kind of situation as a man. Don't get angry and say, what do you want me to do? You want me to go and sleep with adults outside? No, don't do that. Be supportive. Have self-control. Is that pregnancy state, when she's out of it, everything will be fine. Of course, some of them, their libido will even increase seriously during the pregnancy. But whichever one you find in your hand, just see how you handle it. Breastfeeding. When a woman is breastfeeding, her libido can be low. When a woman reaches menopause, any woman from 50 and above, their sexual urge to go down just like a man. Then when a woman is sick, illnesses, a woman now that's having arthritis, cancer, even ordinary malaria, no woman will be having serious fever and you say you want to have sex. That's not the time to have sex. It's time to take care of her and let her be okay. Then there are some antidepressant and hypertension drugs that can make the libido of a woman to go down. You just need to change those drugs. Then when a woman is not sleeping well, it can make her libido to go down. When a woman is overworking herself, she goes to work in the morning, she comes back by 4 o'clock, she cook, she wash the plates, she bathe the children, she tuck them to bed, she has work from office, and after she has done all this, you didn't help her. You now told her to open her leg around 11 or 12 o'clock, and she wake up around 4 and 5 and still cook for the family. Help with chore. If you have money, get house, get for her. Free her from stress, and then her libido will come up. Pain during sex. If a woman is having pain during sex, she may not want to desire to have more. If a woman is stressed, anxiety, a woman that is having depression, a woman that has body image, the woman thinks she's not okay. Maybe after she has given birth, she thinks she's no longer fine. You need to give her affirmation. Tell her she's beautiful. Past trauma, a woman that has been raped, sexually abused, marital conflict, you're always fighting your wife. Then in the night, you say she come and have sex. How? How will she have the desire? If I to her, you are like a stressor. So how will she enjoy you? Somebody you are stressing. Negative spiritual upbringing. Maybe as a woman, your mother has told you that sex is a terrible thing, then when you now get married, you now see sex as a terrible thing. So your husband will say, let's go have sex. He said, you don't know more than sex. Because of that thing that your mother has told you when you were growing up. Please delete it in your brain. There's nothing terrible about sex. It's the gift of God. As far as within marriage, enjoy yourself. If you are taking alcohol as a woman, your libido can go down. If you are not eating balanced diet, your libido can go down. Then number 2, sex avoidance. Why will a woman be avoiding sex with her husband? Life changes, motherhood, pregnancy, menopause, stress, so many things. Caregiving responsibilities. This your wife is taking care of her mother that is sick. He's taking care of her father that is sick. He's taking care of the children. He's taking care of you. She's going to work. She's doing all the chores in the house. If you say sex, that's the last thing on her mind. So all those problems need to be removed before she can enjoy sex. Then number 3, difficulty becoming physically aroused despite desire. Yes, as a woman now, you have desire, you want to have sex, but your husband is touching. You're not even feeling it. What could cause this? Monotony. That's one of the things that can cause it. Monotony. Like, the man is not performing well. It's the same way. You already know how it will go. It's just to lie down on you. There is no foreplay. The sex is not interesting. So at the end of the day, okay, let you come and do it so that I can rest. I want to go and sleep. Come and do it. Because you know that it's the same way. So that's why as a man, you have to be innovative in your sexual life. I've told us 72 different positions, different places. Can explore those things. And then the woman will be looking forward to different things. Do foreplay, kiss her, play with her, say good things about her, enrich your sexual life so that the woman can be physically aroused. Then vaginal dryness during sex. Hormonal changes can cause this. Pregnancy, breastfeeding, labor, a woman has just delivered, she's having pain. Maybe during the delivery, she has a cut. They cut her, or she has a tear. She may be sensitive to all those things. Then if you don't have enough foreplay, a woman you didn't play with, you are not romantic. In the afternoon, you didn't ask about her work. You didn't say, how are you doing? How's your day going? You didn't say, loving things, romantic things to her. You didn't send a note. You didn't buy a gift when you are coming from work. You did not, you are not romantic. Then in the night, you just grab her. Women are not like that. Women are this kind of people that their body is prepared for you when you have prepared their mind. Then you have their body. Say good things to her. Don't fight with her. These are all the things that can cause vaginal dryness during sex. Then if a woman is smoking, anxiety, stress, different illnesses, diabetes, all these things can cause a woman to dry up during sex. So if you have any of these problems as a woman, you need to take care of them. Then number 5, a woman that is not reaching orgasm, it can be due to stress, it can be due to anxiety, depression, past trauma. She's not seeing sex as anything good again because somebody raped her, somebody forced her. So her mind is switched off, her mind is closed to sex. So have sex till tomorrow. It's just there like a log of wood. So all these abuses, you have to see a doctor, you have to see a psychologist, a psychiatrist. They need to work on those things. You have to be taken out of that past trauma. Marital conflicts, the woman you are fighting, orgasm is the last thing on our mind. Performance anxiety, as a woman, you too. So women to have this fear that, they may not be able to satisfy their husband. That can lead to a woman not reach orgasm too. Hormonal imbalance, your sex hormone has gone down. Illnesses, smoking, poor sleep, alcohol, inadequate foreplay. If you don't do a lot of foreplay, by the time you are doing the play, you may not be able to take your wife to orgasm. Because the essence of play, the intercourse, is to take orgasm. But the woman you have not kissed, you have not touched her breast, you have not done all those things I've taught us. You just lie on her, just like that. As you are leg and enter, the woman will not reach orgasm because you have not done the enough preparation. So all these things are very important. Then difficulty reaching orgasm, like I've said, all those things I've said, overthinking during sex, performance anxiety, emotional disconnect, lack of foreplay, all these can cause a woman to find it difficult to reach orgasm. Then pain during intercourse. What could make a woman to be having pain during intercourse? When you are meeting with your husband, you are feeling pain. Hormonal changes like pregnancy, menopause. During menopause, all your hormones have gone down. So you feel dry. Then you feel pain easily. All these ones, you can use cream. Then infection. If you have urinary tract infection, sexually transmitted infection, as a woman, you can start feeling pain when your husband is making love to you. Then gynecological conditions like fibroid. Some fibroid are very close to the vagina. So as you are having sex, it's as if the penis of your husband is touching the fibroid. You'll be feeling pain. Then if you are this woman that you have fear, you think as your husband wants to enter inside you, you feel you are afraid, it can give you pain. Then if you have just done surgery recently, maybe like CS, you can be feeling pain when you are meeting with your husband. Then if you just give birth, stress, anxiety, depression, past trauma, sexual abuse, marital conflicts, all this can lead to pain. Number 8, when a woman, there's something called vaginismus. Vaginismus is when a woman's vagina closes. Immediately that your husband wants to make love to you, your vagina closes. It's a fear that can be caused by anxiety, can be caused by stress, past trauma, negative sexual thinking, sexually transmitted disease. If you are a woman that you have had more sex in the past, maybe somebody that some people can mute can we mute our mic? A woman that has had rough sex in the past and she has got injured in the process may be having vaginismus. So all these are very important. Then a woman that has had tear before, then childbirth, all these things can cause the problem. Then number 9, long-time pain around vagina. A woman that is having pain in her vagina, it can be due to irritation around the vulva. There are some pants that some women wear. There are some pads that you use to do menstruation that can give you irritation and cause wound for you around your private parts, and that can give you pain during sex. Then hormonal changes, pregnancy, and all those things. Sexually transmitted disease, urinary tract infection, all this can cause problem. Then sexual dissatisfaction. Why will a woman not be satisfied sexually? A good example is a woman that they have removed the clitoris. Clitoris is the major sexual organ of a woman. If you have been circumcised, it can make you not to have sexual satisfaction. Chronic illnesses, a woman that is sick, a woman that has pain during sex, all these things can give a woman. Then a woman that has low libido, it can give the woman problem also, that the woman will not be satisfied. Then negative upbringing. Your mother has told you that sex is evil. You may not enjoy sex. You may not enjoy yourself. Then lack of sex education. You know, that's why I gave us this sex education, how to have good sex. Many people, they don't know how to have good sex. That's what I've explained to us today. And if you still want to learn more, you can contact me personally. I'll give you more education. Everything we learn in life, we need to learn it. The same thing with sex. A lot of people didn't learn anything about sex. They just went into marriage like that. Then the husband will now say, do your leg like this now. Do your leg like this now. The woman doesn't know what to do because she doesn't have any education about sex before going to marriage. So it's very important to have good sex education, how to have sex and enjoy it in marriage. Then pornography. Some women, they can watch pornography and that makes them to have unrealistic expectation. They believe that the husband should be like the man inside the pornography who can. This is something that is not real. This is something that they have edited. They have done all sorts of things. But the man can do and do for 2 hours. Then you want your husband to do the same thing. You'll be disappointed. And that can lead to problem that you'll not be satisfied. Then body image. There is a way that our media has portrayed how a woman should look like. They will tell you that, yes, you should be slim, agbanida rego. That's the image that is accepted. And because of that, because you are on the big side, you hate yourself. Even if your husband loves you like that, you don't believe her, you don't believe him. You want to be like agbanida rego. Stop all those things, you don't need it. Social media standard. There are some people on social media that they are the standard. Discard all those things. Cultural standard, all those things. They can affect us. Their past trauma, lack of partner affirmation. That's another thing. Husband, learn to affirm your wife. They need reassurance from time to time. Tell your wife you are lovely, you are beautiful, you are sexy. Appreciate her body parts. Your breast is so fine, your nipple is good. Say so many good things to her. That will increase the confidence in her body and you make her to enjoy sex. So all those things can cause body image. Then pregnancy. Please don't abuse your wife during pregnancy. I have seen a situation that a man and a woman came to my office and the woman is pregnant. The nose was a little bit big because of the pregnancy. And the husband was saying it in my presence. I was saying, see how your nose is now so big. You are not even fine again. Don't say that to a woman. I'm begging us. If your wife is pregnant and her body has changed, still praise her. Still appreciate her body. Don't mention all those areas that the pregnancy have affected her. It can affect her libido, her body image, and it will affect her sexual life. And then when a woman has lost any body part, maybe somebody that has breast cancer and they have cut the breast, or somebody that has fibroid, they have removed the womb. This can make them not to enjoy sex. Bear with them, understand with them, and gradually help them out of it. It's not their fault. The woman is very emotional. All those body image things can affect their libido. Then the last thing is sex hormone. The sex hormone of a woman is estrogen. So many things can make it to be low. Menopause, polycystic ovarian syndrome, illnesses like thyroid problem, stress, poor diet, sleep problem, excessive exercise. When a woman exercises too much, it's not good. When you don't exercise at all, it's not good. So the thing must be balanced. Then as you grow old, your sex hormone go down. Come to terms with this reality. If you are 50, 60, just know that you can't be as, your sexual urge cannot be as when you are 30, 40. So these are all the realities you need to adjust to. Then if you are using any drug, either for hypertension, for depression, and it's affecting your sex hormone. You can adjust it, you can change it. See your doctor, and everything will be good. Thank you so much.
Wow. Thank you so much, doctor.
Thank you.
So much.
Thank you, doc. Thank you.
Let us
Thank
appreciate
you, Doc.
Dr. Yes,
Thank you
thank
so much.
you.
Thank you so much. I appreciate.
Thank you.
Thank you, doctor. You did a very great job. Well done.
All right.
Questions?
Yes, having heard doctor, it's time to ask questions. If you cannot speak, you can write. Doctor will go through the chat and respond to all of them. And the more the question comes, I'm sure, the more she's going to talk more on those burning issues. Doctor has really said a lot that should help marriages, especially sex in marriage. Because like she has told us, sex in marriage is the best gift God gave to couples for bonding, for understanding, for show of love and care for one another. Like she said, if your spouse is not interested in sex, please find out. Do not jump to conclusion. Try to find out what is the matter. Sometimes the problem, when discussed, can be solved without having to get to the doctor. Someone who is emotionally down will need some encouragement to be up. Or if you lost a loved one, sometimes you need just to talk to somebody. So I want to encourage us to please ask questions. This is not a class where, a seminar where you hold your breath or your words. Please speak it out the way it is. It's an adult class. Call the body organs as they are if you want to ask questions. Do not paint or try to give another name to the body parts. Please ensure to call it as it is for better understanding so that the answers can come while all of us will listen. Thank you so much. Now, if you are ready to speak, please raise your hand, go to the reaction points and raise your hand so that we can bring you in to ask your question. Thank you. Once again, doctor, we say thank you so much. Thank you so much.
And thank you for your time too.
No, we are all trying to help the family work well. And part of it is sensibility. If it's not working, it is not working. That's the truth. And most of the problems after is sex. So this is the burning issues that are not discussed, even in the churches. So it's good we are discussing it now. So thank you once again. Okay, I've seen a hand up. Stephen, your hand is up. Please go ahead and ask.
Good evening, everyone. Good evening, doctor. Please, I don't know. How can I want to meet the doctor one-on-one.
Okay, you want to meet doctor one-on-one. Doctor will answer that if you are close to his location.
I'm based in Abuja.
Doctor,
okay, I'm based in Abuja also.
Okay, so okay, doctor, you are good.
And the father has my number. Father Thaddeus have my number.
Okay, Father Tayo.
Yes. So okay. He has my permission to share it with anybody who wants to share it.
Okay, okay. Thank you, sir.
Thank you, doctor.
Okay, sir.
Thank you. Please, who else is asking questions? Move so that we can move on. Who else is asking questions? I'm not seeing questions on the chat box. There's no question.
Maybe the thing was well understood and everybody's overfed.
My hand is up, but you're not seeing it.
I'm not seeing it. That's why I'm trying to check who and whose hand. Okay, Miriam, Teresa, Ugo. Please go ahead and ask your question. Thank you.
Okay, thank you. Well done, Doctor. Thank you so much for the wonderful presentation and your talk. Good evening, everyone. So my question is, I know from the beginning when you started talking about the problems, you said there are many problems about sexual marriage. How do we call it? Problems. The problem of, how do I put it now? There are many sexual problems in marriage, but you are going to mention few of them. Then I remember that there is one called sexual anorexia, something like that. And I did not hear when you mentioned that. So I was wondering, is it not a big problem, or where did it fall in among the problems you mentioned? Thank you.
Sexual anorexia.
Yeah.
The sexual problems I mentioned. Let me list them for us. Let me list them for us again. I mentioned 25 of them.
Yeah.
I mentioned 25 of them. 13 men, and 12 in women. So, and I said each of them can come up as different stages of the 4 stages of sex: the desire stage, the arousal stage, the orgasm stage, and the resolution stage. So for men, okay, I will give this slide to Father so that he can share with us. So
okay.
Yes, the 13 I mentioned, I want to list it for us. The 13th I mentioned for the men, okay. For the men, these are the 13. Because so these are the 13 I mentioned for the men. Number 1, low libido, sexual avoidance, erection problem, lack of sexual excitement. Number 5, premature ejaculation. 6, delayed ejaculation. 7, inability to reach orgasm. 8, pain during ejaculation. 9, painful curvature of the penis. Then 10, pain in the prostate during sex. Then performance anxiety. Then lack of interest in sex due to psychological causes. Then sex hormone imbalance in men. Then in women, I mentioned 12, low sexual libido, sexual avoidance in women, difficulty becoming aroused despite having desire to have sex, then vaginal dryness during sex, then absent orgasm or difficulty reaching orgasm, then pain during intercourse, then vaginismus, that is when the vagina quickly closes before a man can enter due to fear. Then pain around the end when you are entering during penetration, when a woman is having pain. Then sexual dissatisfaction, the woman is not satisfied. Then body image, the woman that doesn't like her body. Then sex hormone problem, the sex hormone of the woman has gone down, so he's not interested in sex again. So those are the 25, 13 for men and then 12 for women. So
okay.
Which one are you trying to refer to among them?
Yeah, I think it has connections to the ones you mentioned, because in the problem of the sexual libido, or what you call it, it has connection to it anyway. So I can fish out some things under the anorexia, because it says something like anorexia in eating anyway. So it's likewise the problem you have mentioned.
Okay. So there is no problem, because one, this is recorded. So Father has the recording. That's one, he can share it too.
Thank you.
I've shared my slide with Father. Everything I discuss now is inside the slide. So I've given it to him. He can share it in the group so that everybody have the slide.
Thank you.
Yes. I can see something in the chat. Somebody was saying that, how do you encourage a partner to live with somebody that has sexual problem in marriage? I saw it in the chats. Am I right?
Yes, doctor, it's there. You can answer it. Thank you, doctor.
Now, it depends on the foundation of the marriage. My concern is that I hope there is no deceit. I hope the sexual problem was not there before marriage, because I've had to deal with that one in my consulting room too. A man that the penis is not working. He didn't solve this problem. He deceived the woman that premarital sex is bad. Then the woman said, no problem, I'll wait till marriage. In the night of the wedding, oh yeah, Oga, come and do. That's when the woman is discovering for the first time that the man is impotent. That's very wrong. You should not build your marriage on that deceit. Such sexual problem did not occur in that marriage. It occurred before that marriage. But you deceive the other partner. That's very, very wrong. But let's say, okay, this is a sexual problem that started in the marriage. Maybe somebody who has been doing well in marriage, people have been enjoying your sexual life, and suddenly, maybe the man is not performing well again, or the woman is not performing well again. I won't encourage anybody to live with sexual problem. But that is the essence of this lecture. That is the essence of an expert like me. Come and see an expert. Let us see the root of that problem. So it's not just to encourage you to live with the sexual problem. No, I won't encourage you to live with it. I'm not saying you should divorce your partner. I'm not saying you should separate from your partner. Find solution to the sexual problem. You are not supposed to endure sex in marriage. You are supposed to enjoy it. So if you're having sexual problem in marriage, don't live with it. You and your partner. Just this week, I've seen more than 3 couples coming to come and complain, either erection problem, and you see the woman, they are the one that even lead the way. They will tell you that, doctor, my husband thing is not working, help us. And when I finish with them, they will say, doctor, it has started working, In fact, one of them came to give me 5,000. That doctor, the thing is on fire now. Don't live with it. Don't endure your sexual life. Solve the problem. Every sexual problem has a solution.
Fantastic, doctor. Don't live with it. Get yourself fitted and go back to life. All sexual dysfunction can be fitted. Thank you so much, doctor. Thank you for this insight. Please, we still need more questions or reactions, comments, please, before we'll call it a day.
And if people have more questions, I'm in the group. I'm in our Catholic group. So you can still ask me your questions there. I'm there. I will answer the questions.
All right.
Yes.
Okay. Just before we close, I wish to once again thank Doctor for this beautiful seminar.
Thank you very much, ma'am.
People pay so much to participate, but here we are. For a token, and you are spending your time with us. Thank you and God bless you. But I quickly want to add, for women and men who are very, very busy, this is my little contribution. Based on my experience. I will suggest that when you are very tired and you have returned, and possibly your partner was home, very happy, excited, and waiting for you, and you meet you and want to have sex with you, please, if you have said no yesterday, don't say no today. And don't say no the following day. It kills sex. Now, the best to do, as far as I have tried, is to pray. I quickly offer prayer. Lord, my husband is happy. My husband is strong and healthy, and he needs me as his wife. Give me grace to perform my duty as a wife. And to the glory of God, strength will come. Strength will come, and I will not remember I was so tired. I perform my duty. And even on Sunday, my husband will commend me for the job well done. So I want to tell us that Jesus Christ said, I'll be with you even to the end of time. Therefore, even in the bedroom, God is with us. And so we should call on him at every point, and he will send direction, guidance, as far as our sexual life is concerned, because since this is his gift, he is making those best how to meet us. Once again, thank you so much, Doctor. And to all our
Please, I have a question.
You've been asking to raise your hand. Thank you. Okay, go ahead and ask your question.
Please, I'm sorry. I came a little late, so I really don't know what was discussed earlier on. But I just have a question for women that have for example, endometriosis, or they have conditions like, I think it's called vaginismus, or I don't know how they pronounce it, where penetration is a little bit painful for them. So how would they navigate something like that?
It's very simple. If you have something like endometriosis, there is solution. We can do surgery, we have drug, we can treat it, and once it's treated, off that one goes. Then if it's vaginismus, what we usually, all those things that I've mentioned that can cause them, we will try to find out what could be the reason in that person. Okay, let me use an example of a couple. They just got married. The lady is a virgin. She has never had sex before in her life. So they called me that to penetrate has become a serious problem because all her life she has kept herself. She doesn't have any sex. I mean, she has never had sex with anybody. So as the husband wanted to enter for the first time, psychologically, she has not really come to terms with the fact that, oh, what she has felt for years, 25, 26 years of her life, she's about to now open up and somebody will enter inside her. So anytime the husband wants to enter, the vagina will close. The vagina will close. So what I told them is this. I said for now, the husband should calm down. For the next 1 or 2 weeks, he should forget about penetrative sex. They should do a lot of foreplay. Let her mind, let her unlearn all those guards she has put on that make her to guide herself to that point in life. 26 years of not having sex with any man. So it's not easy that one night of the wedding, she just lose all the guard. So psychologically, she's still guarding herself. So I told them to forget about penetration. The husband should bear with her. They should just be having every sexual intimacy act apart from penetration. So then they wake up, they will kiss, they will do all sorts of things, they will touch each other, they will do any other thing apart from penetration. Over the 1 week or 2 weeks, she was able to now come to terms with the fact that a man can touch her body the way he likes now. She begins to accept it. And off goes the vagina too. The vagina too accepted the husband. And then the relaxation. And then I encourage them to use cream. There are some creams that they can use. KY jelly cream is very good for sex. So by the time they introduce all those things, now they don't even call me again. They don't disturb me. The last time I called them, I said, I'm not hearing from you people again. They said, doctor, the tea has opened, no problem again.
Okay, thank you.
Thank you so much, Doc. They are so good.
Okay.
We thank God. Please, do we still have questions? Please ask your questions now. Because we'll soon close the class, please. Please ask your question now.
Okay, maybe if people are not asking, they can ask in the group so that I can join another conference. I have other conference again online, and if you have been calling, like I have to speak to some other people again.
All right, so let me invite Father. Our Father is online. And
you should also feel free. Any topic you want me to talk to us about, we can come out with them and let me know. Then we organize it as a workshop or a seminar. Then I will talk about it. Any topic, anyone.
Okay, thank you so much. Father will.
All right, thank you so much. Thank you, Doctor, for this inspiring teaching. Highly educative, very enlightening. We appreciate you for teaching us.
I thank you, sir, for the opportunity, sir.
To bless you and reach you with his knowledge. I appreciate our moderator. Moderator, thank you for moderating. God bless you. And for all our participants, God bless you all. My network has not been wonderful. I don't know if you can hear me.
Thank you, Father.
Yeah. I hear you very well, sir.
I hear you.
Okay, you can hear me very well. Okay, good.
Very well, Father.
All right, so we will conclude with a closing prayer in the name of the Father, and of the Son, and of the Holy Spirit. Amen.
Amen.
We thank you, God our Father, for this teaching this evening. We pray for all married couples who are experiencing sexual problems in their married life. We pray, oh Lord, that through this teaching, let something great, something wonderful, let something beautiful take place in their married life, in their sexual life. And we pray that you may continue to bless our speaker, bless him in all that he does, for the good of married couples, for the good of marriage, for the good of society. And all who participated, I pray that you may bless them, bless their married life, bless their family. Bless whatever they do for the greater glory of your name. As we retire tonight, may you grant every one of us a beautiful and a great night's rest. Bless Catholic Marriage Forum, that through our apostolate we may touch lives, touch families, for the good of the society and for the good of the church and family life. We make this prayer through Christ our Lord.
Amen.
The Lord be with you.
And with your spirit.
May Almighty God bless you, the Father and the Son and the Holy Spirit.
Amen.
Good night. Good night, everyone. Good night.
Good night, sir.
So the slide will be sent to the group. The slide will be sent to the group. So, Doctor, please, you will share the recording with me. The recording in your cloud. You can share it with me. I will share it in the group.
Okay,
Good
I will
night,
have
everyone.
it, sir. How will I know? How will I have it?
Yeah, so you can share it with me later.
No, what I'm saying is that how will
Yeah,
I
you have it
the...
in your cloud.
Okay, I should check my cloud.
Yeah, you have it in your cloud. I made you a co-host and the moderator, so both of you have it.
Okay.
Later, you share with me. Yes.
Yes. Thank you, sir.
Okay.
Thank you, Doctor. Thank you, Father.
Thank you, everybody. Thank you.